Exercise is a double-edged sword. Okay, we're learning more and more about exercise and its effects on health in general, and particularly about cardiovascular health, about the heart and the blood vessels. And we know that for sure, if you exercise regularly, it's associated with increased longevity. You feel better, you feel happier. But on the other hand, we're also learning that we've developed a new subspecialty within cardiology called sport cardiology, where we look after the cardiovascular systems of sportsmen, amateur and professional. And this has only emerged in the last 10 years, and we've realized that through doing a lot of research, doing imaging on athletes, etc., that the amount of atheroma, which is heart artery blockages, present in a person's arteries, is actually correlated with the intensity and duration of exercise they do every week. That's actually quite a surprising thing for most people. Everyone thinks that if I exercise, then my arteries won't block up. Actually, exercise, I said early on, is a double-edged sword. When you exercise, especially when you do extreme exercise, your body actually becomes inflamed. The immune system becomes too excited almost. And when the immune system gets very excited, it sometimes causes collateral damage. It causes damage to the arteries and allows cholesterol to burrow itself into the artery walls and cause blockages. But then the flip side is that because of the beneficial effects of exercise, all these blockages never get to grow very, very big. So the trick for cardiologists and for the general public is to determine what level of exercise is actually safe for them to do, and to determine before they participate in exercise whether it's safe for them to participate in exercise. Because a lot of the times people don't feel things that are problems that are building up inside their bodies until they have a symptom, and by the time they have a symptom, sometimes it's already very advanced. There was a young man, 42 years of age, very fit. He was an ultramarathon runner. The year before, I'd seen him, and he was doing a European ultramarathon. And usually when you go to Europe and do an ultramarathon, they require pre-participation screening. They require you to do an ECG and to be evaluated by a doctor. So I did that. And I also did a stress test on him and ran him on a treadmill at the same time, observed his heart's response. And everything looked normal. Everything looked lovely. So I signed him off, and he went and did his ultramarathon. Now, a year later, he came back to me and said, I just did a longish run over the weekend, and towards the end of the run, I was feeling some chest pain. I sent him for a more advanced test, a CT scan, and I was actually very surprised to find that he had quite extensive artery blockages in very important arteries. We ended up having to further evaluate all these blockages through minimally invasive surgery, put a catheter into his heart and have a look from the inside of the artery. And we realized that actually some of these blockages were causing his symptoms. And we ended up having to put a stent in and then put him on strong medications to reduce the chances that there's a repeat of this problem. But it was a shock to him, obviously, and a shock to me, because you would never expect someone like that with no significant family history, theoretically a normal cholesterol level, no diabetes, never smokes, has an essentially vegan lifestyle, and to develop severe artery disease at that kind of age. Since then, I've also been seeing, been picking up quite a few patients with that kind of profile as well. The moral of the story is that as doctors, we have to be extra vigilant with patients who are theoretically very fit. The intensity and quantity of exercise is correlated with the number of arterial blockages in the heart. the surprising finding. So extreme exercise does increase the amount of this. But net, it's always a risk and benefit balance. Net, exercise is still good for you. If it's beneficial for your psychological status, if it's making you happier, it's making you fitter in general, then it's going to extend your longevity. What the key question is we need, as a medical community and as patients, we need to be aware of this correlation between extreme exercise and damage to the arteries and inflammation, and to identify those patients who are at risk and screen them and pick up the ones who need extra help. Oh, absolutely. We have, the human body has massive reserves. We're born with 2 lungs, we're born with, we only need 1 to survive. We're born with a huge liver, and you only need, half of it or less to survive. You can donate half of it to someone who needs it. We use up this reserve throughout our lives at different rates, depending on how much you abuse your body, your lifestyle, your diet, etc., etc. Generally, you can use up all this reserve and still feel absolutely fine until the very last moment when you're about to drop off the cliff. Then you start feeling something. But by the time you're about to drop off the cliff, it's sometimes very, very advanced already. The solution to this increasingly is personalized medicine and screening. So screening being having a health check regularly, and us as doctors identifying what we call risk factors, things that such as cholesterol, diabetes, etc., that we know that increase the risk of heart disease. And if we see these markers and these markers are out of whack, then we know that this patient is at high risk, and we need to, look further, or we need to maybe start some preventative maintenance. In terms of the cardiovascular system, one of the most important symptoms is feeling discomfort when you're exerting yourself. Whether it's running, whether it's cycling, walking up the stairs, when your heart rate goes up, you're using up some of your reserve. When you're exercising, you get to the phase where you can't take it anymore. That's the limit of your cardiovascular reserve, basically. Between sitting down, where you've got massive reserve, you've got like 80% reserve, and running at full tilt, you have this big range. So, walking up the stairs, walking up 1 flight of stairs might just be using up 10% of your reserve. Running at a slow pace might be using up 30%. Running up Old Peak Road might be taking up 80%. And doing an ultramarathon would be using up 100%. Now, at those different phases, if you start feeling symptoms, especially if you start feeling symptoms at a low utilization of your reserves. So let's say you're walking up the stairs and you already feel uncomfortable. For whatever reason, it might be that your heart's pounding really hard compared to normal. I mean, what's normal for you? You know your body the best. Normally you can run up the stairs without problems, but why is it now you get up to 3 or 4 steps and then you already feel short of breath? If you feel chest pain after you exert yourself, if you feel that your heart is beating too quickly compared to the level of exertion you're doing, you're feeling more short of breath than normal. The most important thing for everyone is to maintain mobility, especially as one ages. If you read this article and you suddenly decide that you're going to start doing a lot of exercise, that's not such a great idea because your body's not used to it. It would be very important for someone who's normally quite sedentary, who's not moving a lot, to start very gently and then build it up. And build it up to somewhere where you're comfortable, where you can sustain it. Don't go to extremes. If you go and do an extreme sport for 1 month and you pull back completely and don't do it for 2 months, then that's actually quite terrible for the body. Whereas if you consistently do just small amounts of exercise, especially exercises that increase your heart rate to a certain extent, then that would be fantastic. Now, one of the most fantastic sports to do is swimming. My observation is that, my patients, the octogenarians and nonagenarians who look the best, who look amazing, are the ones who swim every day. Because swimming, you increase your heart rate, you're using all the muscles in your body, and at the same time, the chances of injury are less. There are various different levels of heart checks and screenings, but the most basic and simple way to screen for your heart problems, especially before you're doing exercise, is to have an electrocardiogram done, an ECG done, and to have blood tests done. And those, combined with a consultation with the doctor, already is able to detect quite a lot of things.